Irkutsk Regional Oncology Hospital is the clinic working according to the most advanced healthcare standards. The hospital is in the midst of an extensive development plan. Among the most recent landmarks is the new hospital building, opening along the boarding house for non-local patients. The next stage is the cutting-edge technology radiologic center construction. Hospital branches located in other cities, along with the central hospital, serve more than 120,000 patients annually. The hospital is the full-circle oncology clinic, where all the key divisions of contemporary oncology are presented. The surgical cluster includes 14 wards: breast surgery, head and neck surgery, reconstructive and plastic surgery, obstetrics and gynecology, general oncology, neurosurgery, thoracic surgery, thoracic abdominal surgery, urology, colorectal surgery. Also, there are the following clusters in the hospital: radiation oncology, chemotherapy, cluster of intensive care, anesthesiology and afferent therapy, cluster of diagnostic imaging, ultrasound, cytology and pathology, endoscopy cluster, outpatient clinic. In total, there are 26 different wards in the hospital. Hospital's diagnostic cluster is fully equipped for detecting tumor of any localization. More than 54,000 investigations are being completed, and more than 53,000 reports from other medical centers are being reviewed here annually. Department of Diagnostic Imaging uses computer tomographers, digital mammographers, MRIs. Ultrasound Diagnostic Department is equipped with sophisticated modern scanners. The laboratory is equipped for analyzing patients' immune system, stem cells counting and evaluating, immune phenotyping in tumors of the hematopoietic and lymphoproliferative processes diagnostic. Laboratory includes Laboratory of Medical Genetics and Laboratory of Molecular Diagnostics. Target therapy of malignant tumors is actively used in the hospital. Centralized cytology laboratory is working in the real-time fashion. In the year 2013, it was equipped for making pap smears that radically increased quality of cancer screening. Pathology department accomplishes all types of immunohistochemistry, breast cancer hormonal status, and HER2/neo studies. Surgical treatment is one of the backbones of contemporary oncology. Annually, the hospital surgeons perform more than 12,000 inpatient and more than 10,000 outpatient surgeries. 27 OTs are constantly on duty. For treating breast cancer, surgeons perform mastectomy surgeries with simultaneous reconstruction. For reconstruction patients, self-tissues or silicone implants are used. Reconstructive and plastic surgeries are being performed using high magnification microscopes. Such equipment allows successful face and jaw reconstruction for patients with tumors of the head and neck. Microscopes are widely used in vascular reconstruction surgeries, in surgeries of retroperitoneal tumors of non-organic origin, and in organ retransplantation surgeries. The hospital surgeons install artificial bones and joints of any complexity. Amputations sum up not more than 4% of total oncology orthopedic surgeries. Segment resection surgery is the unique technique used for saving limbs in cases of a massive tumor growth. Surgeons install artificial scapula, elbows, wrists, and ankles. This is a newly adapted, highly sophisticated surgery of the hip joint replacement, along with a total resection of one of the hip bones. Using minimally invasive approaches in thoracic surgery in performing lung resection, benign tumors resection, biopsies, malignant tumors resection, allowing not only to perform precise diagnostics without open surgery, but also to reduce recovery time down to 12 hours and hospitalization down to 2 days, even after complex surgeries. The hospital's endoscopic cluster is the center of innovations and new minimally invasive treatment techniques. The hospital surgeons perform mucosectomies of any complexity. More than 27,000 endoscopic diagnostic procedures are being performed annually. The hospital has a full-function cluster of anesthesiology, intensive care, and extracorporeal hemocorrection. The cluster can serve 60 patients at a time. Equipment installed here allows performing hemosorption, plasmasorption, automated and discrete plasmapheresis, prolonged hemofilitation, hemodiafiltration, hemodialysis, blood cell separation, UV and laser blood processing, therapy with lymphokine-activated cells. The hospital proactively utilizes new technologies. Tumor chemoembolization is used for tumors of cervix, liver, head and neck, rectum, kidneys, spine arteries, gastroduodenal artery. Tumor stenosis stenting used in large intestine, and tracheobronchial tree, puncture osteoplasty, and vertebroplasty with radiofrequency ablation. Photodynamic therapy of skin, breast, and bladder tumors. Electrochemical lysis of metastasis into liver for stage 4 patients.
Radiation therapy cluster utilizes the most advanced approaches and equipment. Distant radiation therapy is being performed on modern linear accelerator with all the cutting-edge technologies presented. Intensity modulated radiotherapy allows altering radiation levels during the procedure for maximizing tumor radiation consumption and minimizing adverse effects on healthy surrounding tissues. "3D conformal radiation therapy via combination of 2 different shaped beams allows to create the focus of radiation almost similar in shape to the original tumor, while image-guided radiotherapy allows performing radiotherapy treatment on moving organs like lungs, intestines, bladder. Volumetric arc therapy dramatically increases preciseness of the treatment and ability to spare healthy tissues, while stereotactic body radiation therapy simply reduces 6 to 7 times the length of the treatment. Brachytherapy is being performed on 20-channel multi-source HDR, 65 various applicators that can be combined with each other, create an extremely effective system of universal applicator. Virtually, there are no limits. Therefore, in brachytherapy of tumors in gynecology, oral cavity, rectum, esophagus, Stem cells transplantation unit is one more technologically innovative center at the hospital. Started functioning only at 2016, unit already performs autologous transplantations using patients' bone marrow or peripheral blood. This allows effective treatment of Hodgkin and non-Hodgkin's lymphomas, soft tissue sarcomas, and myelomas. Unit consists of 2 wards. One is the high-dose chemotherapy ward for 30 patients, and the other is the transplantation ward for 12 patients. Nearest landmark is reaching 30 transplantations performed annually, as this is the current regional demand for this procedure. At the year of 2017, hospital will start creation of the Bone Marrow Donors Regional Registry and will join the National Russian Donor Registry. This will allow starting successful allogenic transplantations. Hospital's ultimate goal is the Stem Cell Transplantation Center performing on the quality and quantity levels of the world's best centers. Such standards are now presented in Russia capitals but can hardly be found in regional level hospitals.
The hospital is serving a vast region. Full-function branch hospitals are open in the cities of Angarsk and Bratsk. In the city of Osoly-Sibirsky, there is a diagnostic center. And in the town of Sayansk, a palliative care unit. Several times a year, the hospital becomes an international center. Oncologists and surgeons from many countries visit Irkutsk to share new approaches in cancer treatment.